Hello everybody, this is Carlos from Army of Nurses and welcome to another video. In today's video we will be covering arterial blood gases interpretations. Some of the topics that we'll be covering in this video include some basic concepts, what ABG tell us, how acidosis and alkalosis is produced, buffer mechanisms, compensation, some numeric values about ABGs, the ABG technique I use, there's quite simple for interpretation, and some sample cases. So some basic concepts. Acid-base balance is very important in order for the body to maintain normal functions that include cellular, hormonal, and enzymatic functions. Usually, if the balance is out of control, the body will show symptoms that represent the unbalance respectively. So acidity and alkalinity are determined by the amount of free hydrogen ions. Usually more hydrogen ions, it's an indication of more acidity. We will be using the pH scale, which stands for the power of hydrogen. And this is more for the chemical or from the chemistry side of scale, which is a scale that ranges from 1 to 14. So 7 being the true neutral, 1 to 6.9 is considered to be acidic, and 7.1 to 14 are considered to be alkalotic. So from 7, which is a neutral, the less we go, so as the number goes lower and lower towards 1, it means that it becomes more and more acidic. And the same thing goes to the alkalotic side. From 7.1 to 14, the bigger the number goes towards 14, then the solution is more and more alkalotic. Usually, for each number that goes up and down, the solution is said to be about 10 times more acidic or more alkalotic than the previous value that follow it. When it comes to the body, it's a little bit different. So the body's normal pH value is between 7.35 and 7.45, and true neutral body pH falls between 7.40, which if you do the math, it actually falls right between 7.35 and 7.45. So that would be a number to keep in mind. So what do ABG tell us? Obviously, tell us about the acid and base status balances, which translates from the respiratory or metabolic origins of the imbalances. It tells us if there is a requirement or if the effectiveness of oxygen therapy is necessary or if it needs to be enhanced. So it will tell us if oxygenation therapy needs to be initiated, or if it is initiated, does it need to be enhanced further. And obviously it's used for evaluation of interventions, which comes in very important for patients who are on ventilatory support in critical care areas, for example, where when the settings from the ventilator will be titrated up and down, the pressures will be titrated up and down, the PEEP, which is the positive end expiratory pressure, will be titrated up and down, and the FiO2, the fraction of inspired oxygen, will be changed according to the patient's needs. And arterial blood gases will need to be done quite frequently in order to find the right amount of oxygen and pressure and the ventilatory support for patients. So keep that in mind if you are going to be going to a critical care area. The ABGs are very paramount for that one reason. So how is acidosis produced? So we're going to be looking at two ways, the respiratory way and the metabolic way. So from the respiratory side, acidosis is produced due to the accumulation of carbon dioxide in the blood. So carbon dioxide plus water will give us carbonic acid, as denoted here, right? So water is readily available in the body, right? In an adult body, almost 70% of the body is made out of water. So in this case, carbon dioxide becomes the limiting factor, right? So if we have more carbon dioxide, then it will bind with more water that will always be there and will give us more carbonic acid, leading to acidosis. On the other hand, on the metabolic side, the kidneys, they play a crucial role, and they either excrete or reabsorb some of the bicarbonate. So we're looking at two things here: carbon dioxide from the respiratory side and bicarbonate from the renal system. So acidosis occurs when the kidneys fail to reabsorb some of the bicarbonate, because bicarbonate is a buffer that the body has, and it is a natural way to counter acids. So that's one of the ways that the body tries to manage acid and base balances. And in the other hand, so how is alkalosis? So how is bases produced? In the respiratory side, it could be due to the excessive elimination of CO2, such as hyperventilation, when the patient is breathing too fast and too shallow. Patients blowing out all their CO2 and they start to feel very, very anxious. Because of the excessive elimination of carbon dioxide, then there will be very low carbonic acid levels. Remember from the previous slide that carbon dioxide becomes a limiting factor because water is always available, right? So because there's less carbon dioxide, that will result in less carbonic acid and therefore less acidosis, which will probably result in alkalosis. Because there's less acid, there will be more bases, right? From the metabolic side, so alkalosis occurs when the kidney fails to eliminate bicarbonate. Remember, bicarbonate is basic. So how is alkalosis produced? Well, if the kidneys fail to eliminate excess bicarb, or we can call it excess bases, then there will be more bases, more bicarb accumulated in the blood, causing the alkalosis. And this is another slide just to illustrate that. So the buffer system, there's the respiratory system and the renal system. So when we talk about carbon dioxide, we will be talking about the respiratory system. And when we talk about the bicarbonate, we will be talking about the renal system. The respiratory system kicks in very quick to balance acid bases. The renal system takes a little bit longer to activate. So what does the respiratory system do? So in an acidotic state, as in here, right? So when the patient's acidotic, the respiratory system will increase the rate and the depth to blow out the carbon dioxide. When the body's on an alkalotic state, the respiratory system will decrease the respiratory rate and depth to retain carbon dioxide, right? From the renal system, if they're in acidosis, then the kidneys will try to increase the rate of bicarbonate reabsorption and retention, right? As we explained from the previous slide. And if the body is in an alkalotic state, then the kidneys stop the reabsorption of bicarbonate and increases its secretion to try to balance the imbalance. Oops, sorry. So the next slide, we're going to talk about compensation status. So when we do ABGs, there will be three categories that it falls under. It's either uncompensated, partially compensated, or fully compensated. And the difference is just very subtle. So when you try to decipher arterial blood gases and you decide that is an uncompensated result, then the pH will be abnormal. It will not fall between 7.35 to 7.45, and the counter buffers are not activated. That means that you will see either acidosis or alkalotic from the pH, but the counter mechanism will not be activated. It's not going to go the other direction to counter the balance. Okay? In a partially compensated state, the pH is still not normalized, so it still doesn't fall between 7.35 to 7.45. However, in a partially compensated state, the counter buffers, they have kicked in. So either the renal system or the respiratory system, they're going the opposite way of the imbalance to try to balance it. Okay, and lastly, in a fully compensated state, it's when the pH becomes normal. Okay, when the pH becomes normal, 7.35 to 7.45, then it will be considered a fully compensated. However, keep in mind that the counter buffers, they might not be completely normal, but the pH is back to normal. That's what makes it fully compensated. Here's some numbers that are very useful to remember, and these ones I do stress that you get very familiar with them. So again, pH, normal pH in blood, 7.35 to 7.45. The partial pressure of oxygen, denoted by here, PO2, normal range between 80 to 100 millimeters of mercury. The partial pressure of carbon dioxide, denoted here, normal range is between 35 to 45. So what these pressures indicate is when these pressures are high, that means that there is a lot of this gas in the blood. Okay, that's the easiest way to remember it. So if, for example, if PO2 is, let's say, 120, right, which is way higher than 100, that means that the patient is getting excessive amounts of oxygen. Okay, and on the other hand, if let's say that the patient's PCO2 is 60, for example, then the patient's carbon dioxide levels in the blood is actually quite high, exceeding our normal range here from 35 to 45. Last but not least, bicarbonate. Normal range is usually between 22 to 28. Some institutions consider it a little bit lower, or the value changes a little bit. Some institutions consider 21 to 27, around that range, but 22 to 28 is what most textbook will tell you. So this is a simple technique that I use. What we're gonna do is it's very simple. So we're always gonna look at the pH, okay? And I put a little cheat sheet over here, so if you forget, which is always good to remember from now on. So 7.35 to 7.45, that's our normal pH. So if less than 7.40, which, you know, like we say earlier, 7.40 is the true neutral between these two values. Less than 7.40, it will be acidotic, right? Because it's heading towards the 1. More than 7.40 will be alkalotic because it's heading towards a 14 on the pH scale. So pH the first thing we look. Then we look at the PCO2, carbon dioxide, remember which carbon dioxide reflects respiratory system. And then bicarb reflects metabolic or renal system, right? So if we look at this number, PCO2, 35 to 45, less anything more than 45, like here, will be acidotic, okay? Because remember, if we have more carbon dioxide, there will be more carbonic acid produced, leading to acidosis, right? Now here, it will be alkalotic if there's less than 35. Same idea, less CO2, less carbonic acid, less acidosis. Now bicarbonate, same idea, 22 to 28 our value here. Anything less than 22, right? So if there's less bicarb, it will be acidosis, because remember bicarb is basic in nature. So if we have less bases, then we have more acid, right? So, and if it's more than 28, it will be alkalotic. So if we have more bases, then it will be more basic, the solution, right? Easy. Now we're just gonna look at some samples here, okay? So In this example here, we have pH is 7.56, PCO2 is 40, and bicarb is 34. So looking at the pH, 7.56, we know that it falls under the alkalotic state, right? Because it's more than 7.45. Next, we look at the PCO2. If the PCO2, our regular values, remember, is 35 to 45. So our PCO2 actually falls on the normal range. Okay. So next, what we'll do is we'll skip that and we'll look at the bicarb. Okay. The bicarb is 22 to 28, but in this case it's 34. That means it's quite alkalotic, right? Because it's greater than 28. So now all we look at is we look at the pH. pH is alkalotic. We match it. Okay. Which of these two, respiratory or metabolic, has alkalosis in it? And we can see that is the metabolic that's matching the alkalosis. So we say it's a metabolic alkalosis. Okay. And now here comes the part with the compensation. Because the pH is not normal, it's not going to be fully compensated, right? So now we look at the carbon dioxide. Has the carbon dioxide moved out of its normal range to try to compensate for this? It hasn't, right? Because if carbon dioxide would compensate for the excessive bicarb, then PCO2 should go higher, right? Because if it goes higher, means more acid, and because there's more acid, it will counter the excessive base from here. So in this case, we can say that this is a uncompensated metabolic alkalosis. Okay? Now let's gonna look at our next example. So pH is 7.21, PCO2 38, and bicarb 15. So again, oops, sorry, let me clear this up. So in this case here, pH 7.21, it falls below 7.35, right? So that means it's acidotic. Now we look at the PCO2, 38. Does it fall between 35 to 45? It does, right? So it's still in the normal range. So next we look at bicarb then. Bicarb, does it fall between 22 to 28? Was 15. It's way lower, right? Because bicarb is low, it falls under acidosis. So from this example, we can say that it is a metabolic acidosis state. Now we have to add our compensation, right? pH, is it normal? It's not. PCO2, 38, so 35 to 45, it still falls under normal. It hasn't go down to compensate for this. So this one will be a uncompensated metabolic acidosis. Let's clear that up. And look at our example number 3. So in example number 3 here, pH is 7.50, PCO2 is 50, and bicarb is 38. Same. pH is 7.50. Does it fall between 7.35 to 7.45? Well, it's higher than 7.45, so it's alkalotic, right? Now we look at PCO2. PCO2 is 50. Does it fall between 35 to 45? It's actually higher. So more carbon dioxide means more acidosis, right? So we put is acidotic here. And then bicarb. We look at bicarb is 38. It falls way outside 22 to 28, right? So bicarb is actually quite alkalotic because it's higher than 28. And it's alkalotic. And then we just match. Which one of these two match the pH? And we can see that is the metabolic one. So this one here is a metabolic alkalosis. Now by adding our compensation, pH is normal? It's not. So it's definitely not fully compensated. Has the PCO2 become abnormal to compensate for the bicarb? Yes, it has, right? So the bicarb is actually, because it's alkalotic, PCO2 has become acidotic to try to balance that. So this one is a partially compensated metabolic alkalosis, right? Let's clear that up. Let's move to our next example, example 4. Same idea. So pH 7.26, PCO2 56, bicarb 24. Again, pH 7.35 to 7.45. This falls below 7.35, so is acidotic, right? PCO2 56, it's beyond 35 to 45. So greater than 45 is acidosis. Now we look at the bicarbonate. Bicarb is 24. It falls under 22 to 28, right? So it's normal. So in this case, we start to match. Which one of these two matches the pH? And obviously is the respiratory side, right? So we have respiratory acidosis. And when we add the compensation in, is the pH normal? No, it's not. So it's not a fully compensated. Has the opposing factor become abnormal to try to compensate it? Well, let's see. CO2 is 56, so it's acidotic. Bicarb, right, is 24, so it's normal. So this is a uncompensated respiratory acidosis. Okay? In order to be partially compensated, then bicarb should go up. Right? Because more bicarb equals more base. And because we have more base, we can tackle the excess acid from here. Right? Remember, acid base. There's only two fighters in this fight, and they need to balance each other. Okay? Let's clear that up and move to our last example. Example number 5. So again, pH 7.36, PCO2 52, bicarb 32. Again, looking at the pH 7.35 to 7.45. Now pH actually falls within normal range, right? It's 7.36, so falls between 7.35 to 7.45. However, remember that when I told you that the true neutral pH is 7.40, right? So in this case, pH will still be slightly acidotic because it's less than 7.40, right? Now we look at the PCO2. 52 is greater than 35 to 45, so is acidotic. And the bicarbonate, we look at it, and the bicarb is 32, which is greater than 22 to 28, right? Our ranges. So because bicarb is higher, that means it's more alkalotic. Now we compare which one of these two match our pH, and obviously is the respiratory one, right? So we can say it's a respiratory acidosis. Now adding the compensation on, pH, is it normal? Yes, it is. It falls between 7.35 to 7.45. Good. And now, has the opposing forces become abnormal to try to make the pH stable and back to normal? Yes, they have. So this example here is a fully compensated respiratory acidosis. Okay? Let's clear that up. And that's it. That's a very quick overview of how to interpret ABGs. I hope that it helped you in a sense to better understand this. Different people will develop a different way to understand how to do ABGs. This way works for me, and I decided to explain it to some people. Hopefully some people will understand it this way too. Thanks for watching, and I'll see you next video. Remember to like and subscribe. Thank you very much.